Gentlemen, if your prostate has been swollen for months or even years, and every so-called prostate formula has left you disappointed, you're in the right place. Many men end up spending a small fortune on supplements that look impressive on the label, but deliver almost nothing where it matters. Most of these products use weak doses that never reach the prostate in a meaningful way. Your gland isn't asking for 10 exotic herbs you can't pronounce. It's asking for 3 vitamins that actually help reduce swelling, calm irritation, and support a stronger, steadier urine flow. I'm Dr. Catherine Rotker. Today, I'm going to be the doctor who gives you straight answers. You'll learn the 3 vitamins your prostate is craving right now, the exact forms that work, and the amounts your body can actually use. This gives you a clear and simple path forward, so you're not wasting money or hope. And make sure you stay with me, because the 3rd vitamin is a genuine game changer for shrinking the prostate. But it only works if you take it at one very specific time of day. Miss this part, and you will miss most of the benefit. Let's talk about our first vitamin, niacin, also called vitamin B3. This is your internal plumber. I like to call it the circulation booster because that's exactly what it does. Many of the uncomfortable feelings you have, that heavy pressure, the constant urge to go, often come down to 2 simple problems. The tiny blood vessels around your prostate have narrowed, and the blood itself has become thicker, more sluggish. It's like the plumbing system down there has gotten clogged. Now, you might be thinking, well, I already take a multivitamin, so I must be covered. Unfortunately, that's a myth. The amount of niacin in most multis is a tiny fraction of what you actually need. It's just enough to prevent a deficiency, not nearly enough to force open those narrowed vessels and get things moving properly. Using a multivitamin for this is like trying to put out a house fire with a squirt gun. You need a therapeutic dose to see a real change. This means you must get the right form of niacin. Look for the one called nicotinic acid. This is the flushing kind. Now, I know the word flush might sound a bit scary. Here, it's actually a positive sign. That warm red tingling on your skin is not a side effect. It is the proof. It's a direct signal that the niacin is working, rapidly opening up all those tiny capillaries and bringing a surge of blood flow directly to your prostate. Please do not be tempted by the no-flush versions like niacinamide or inositol hexaniatinate you see on shelves. They are popular because they are more comfortable, but that comfort comes at a cost. No flush means your blood vessels are not getting that powerful, widening effect. Choosing a no-flush niacin for prostate circulation is like driving on a spare tire. You will not get the performance you need. The safest and smartest way to use niacin is to start slow and rise slowly. Begin with 250 milligrams of flushing niacin just once a day and always take it with a meal. This helps your body adjust. About 2 weeks, if you're handling it well, you could move up to 500 milligrams. This is where a lot of the prostate shrinking action happens, as your blood flow ramps up significantly. And it's always a good idea to let your doctor know before you increase the dose, especially if you have a history of liver issues, diabetes, gout, or if you're on medications for blood pressure or cholesterol. That flush feeling, the warmth and redness, usually kicks in about 15 to 30 minutes after you take it. It typically lasts just 15 minutes or so, then it's completely gone. If it feels a bit strong at first, taking it with a full meal or a simple anti-inflammatory like ibuprofen about 30 minutes beforehand can really help. Some even use a low-dose aspirin in advance, but check with your doctor if that's safe for you. The best part is your body adapts. Within a few weeks, that flush becomes much milder, and many of my patients start to see it as a reassuring sign that their circulation is getting a boost. This works so well because niacin does two important jobs at once. First, it forces your blood vessels to relax and widen, creating more space for blood to flow. Second, it helps thin your blood, making it less sticky and sluggish so it can glide through those newly opened passages. This 1-2 punch delivers more oxygen and nutrients to your prostate while helping to carry away the fluid and waste that cause swelling. The result is that heavy, congested feeling begins to lift, and you start to urinate a bit more freely. Niacin is your first big step toward relief. The flushing form at 250 to 500 milligrams a day opens tight pelvic vessels and helps your prostate get the fresh circulation it needs. Remember, the flush is your friend here, and consistency is the key to harnessing the full benefits. Now, while niacin is working on clearing the pipes, we need to address the irritation inside those pipes. This brings us to our second vitamin. I call this one the inflammation fixer. Its real name is gamma tocopherol, which is a specific and powerful form of vitamin E. Now, if niacin is the plumber, then this vitamin is the soothing oil that calms the whole system down. The tissues around your prostate can become inflamed and stiff over time. Gamma tocopherol works directly on those tissues, helping to restore their flexibility and ease that internal irritation that contributes to swelling. Now, this is very important. Most vitamin E supplements you find are filled with a form called alpha tocopherol. But for prostate health, that is the wrong one. You need to look for the gamma form. Think of alpha tocopherol as a general guard. It's good for basic protection, but gamma tocopherol is like a specialized repair team that goes directly into your soft tissues to fix the specific damage causing inflammation. Your body uses up this gamma form very quickly, but does that make it less useful? Not at all. It just means you need to take it every single day to keep that anti-inflammatory effect active and consistent. The fact that it doesn't linger like alpha tocopherol is actually an advantage when you're taking it daily. It does its targeted work, clears out the gunk, and doesn't accumulate to cause issues. Now let me simplify the numbers for you because vitamin E labels can look confusing. For your prostate, a good daily dose falls between 100 and 200 milligrams of the gamma component. Always check the label to make sure you see gamma tocopherol listed. And remember, we're talking about milligrams, not micrograms. It's also a good idea to take this supplement with a meal that contains some healthy fat, like a handful of nuts or a drizzle of olive oil. This helps your body absorb it properly. You might wonder, can I get gamma tocopherol from food? The answer is yes. You can find this vitamin in foods like walnuts, pecans, pistachios, and sesame seeds, but to reach the therapeutic levels we're talking about, you'd have to eat unrealistic amount of these every single day. We're talking cups and cups of nuts. A quality supplement is the most reliable way to get what you need. So food works as a nice base. The supplement then gives you the steady, reliable amount for your prostate needs. Also, because vitamin E is fat-soluble, it absorbs best when taken with food that contains some healthy fat, like eggs at breakfast, yogurt with nuts, olive oil on vegetables, or a dinner that includes fish. Let's drill down on why gamma tocopherol is so crucial for your prostate. The enlarged prostate isn't just a matter of size. It's also irritated and inflamed on the inside. Chronic inflammation acts like tiny, sharp pieces of gravel grinding away in the delicate tissues of your prostate. This constant irritation causes swelling, stiffness, and pain. It's the major reason the gland stays puffed up and hard, squeezing the urethra, the tube your urine passes through, and making it difficult to empty your bladder. On top of that, Oxidative stress, which often goes hand in hand with inflammation, causes rust on a cellular level, much like rust making a metal hose nozzle hard to turn. The net effect of all these: poor circulation in the prostate's microvessels and a gland that just won't shrink. This is where gamma tocopherol shines. It neutralizes those irritating particles. It seeks out and soothes the internal roughness that keeps your prostate swollen. You can think of it as taking sparks away from dry leaves before they catch fire. Over time, this calming action allows the congestion to ease and the tissue to soften, which leads to a reduction in size and a noticeable relief from pressure. This process doesn't feel like a pain pill. You won't swallow gamma tocopherol and feel instant relief in 20 minutes. It works quietly in the background, day after day. Most men notice the changes over weeks. The area feels less tight. The urge to rush to the toilet loses some of its grip. So with niacin boosting your circulation and gamma tocopherol calming the inflammation, we have addressed two root causes. But there is one more vital piece we need. This brings us to our last but absolutely not least vitamin, the one that makes everything work together properly. This is vitamin D3, and I call it the master regulator. Now I can share that important timing detail I mentioned at the start. Think of it this way. We have niacin opening up the roads for better traffic flow. We have the gamma vitamin E smoothing out the rough pavement, but without a traffic director, things can still get chaotic. Vitamin D3 acts as that essential director inside your body. It sends the specific signals that help keep your prostate cells growing at a normal, healthy rate instead of expanding out of control. You must use the D3 form, which is listed as cholecalciferol on the bottle, the same type your skin makes from sunlight. It's a far better absorbed and utilized than vitamin D2, which is an older version that doesn't produce the same impact in the prostate. And you need a meaningful amount to make a difference. A dose of 1,000 to 2,000 international units each day is what I typically recommend. That's about 25 to 50 micrograms. The very small amount found in most multivitamins simply will not provide this regulating effect. Vitamin D3 works like a master switch. Once your body activates it, it helps manage how your cells behave. For your prostate, this means it helps slow down unnecessary cell growth that leads to enlargement. If you image the prostate as a lawn that's overgrowing, vitamin D3 is like the reason that slows the growth and tells it to go dormant for a while. It also calms the local immune response, reducing inflammation right in the prostate environment. This direct regulation supports the work the other two vitamins are doing. Now for the critical timing. You should always take your vitamin D3 in the morning with your breakfast. There are two simple reasons for this. First, vitamin D is naturally linked to sunlight and daytime activity. Taking it later can interfere with your sleep for some people. Second, your body and your prostate are metabolically more active during the day. Taking D3 in the morning ensures it's available when your system needs it most to send those regulating signals. This simple step makes a real difference in how well it works for you. So there you have it, the complete trio to help shrink and enlarge prostate and relieve those frustrating symptoms. Niacin boosts your blood flow, gamma tocopherol soothes internal inflammation, and vitamin D3 provides the master signal for healthy cellular function. Together, they address the core issues from every angle, giving your body the specific support it needs to find balance and relief.
Now, allow me to address something important I hear often. I want to quickly dispel the notion that taking huge doses will speed things up. I've met many men who doubled or tripled their amounts, thinking they'd see faster relief. It rarely works that way. Taking 2,000 milligrams of niacin instead of 500 won't open your vessels any better and can make the flush much more intense. Taking 10,000 international units of vitamin D3 every day without supervision can push your calcium too high. The goal is to stay in the effective zone and show up consistently. Because these are potent therapeutic doses, a quick chat with your doctor is always the wisest first step. This is especially true for niacin. If you're on medications for blood pressure, cholesterol, or blood sugar, or if you've had issues like gout, stomach ulcers, or liver trouble, I want you to loop your doctor in before you start. They'll make sure it fits perfectly